Hello and welcome back. In this segment, we are going to talk to Dr. Arjang Naim, based on Los Angeles. He is gynecologist, and I wish one of my co-hosts, she was here and she could interview with him. But it's okay. It's okay, right? Yeah. So let's see what's gonna happen. So, hello, Dr. Naim.
Hello, Mr. Laiji. Good to see you.
Pleasure to have you. How are you?
Good, great. How are you
Okay,
doing today?
I'm great. How was your week?
Good. You had a busy week, busy day today. Full office schedule, and tomorrow is Friday, so week almost done.
So,
I'm a full-time OBGYN. We had some deliveries, some surgeries, kids at home, the whole
mhm.
package.
So, first of all, welcome to Togetherness TV.
Thanks for
And
having me.
it's a pleasure to have you. Dr. Naim, you are gynecologist. And we had lots of, questions. And the most, common question was, so, about coronavirus and pregnant people, you know, is it anything you can
Well,
tell us about that?
we're in a pandemic right now,
Mm-hmm.
so everybody's mind is on coronavirus.
Right?
The good thing is that when you're pregnant, it doesn't increase your risk of having the disease or complication from corona. That means that if you're a healthy pregnant woman, like most of people, you will not have any symptoms and any complications. Um, in the hospital right now that I work at, every patient walks in to be hospitalized, get tested for corona,
Mm-hmm.
and unfortunately, a lot of them do come positive, but they have no symptoms
Wow.
whatsoever, and they get treated just as usual, except that the nurses are more cautious. When the baby is born, they test baby also.
Mm-hmm.
Um, the CDC recommends that the mother, if it's corona positive, can actually breastfeed with precautions, but that's something that every patient decides on themselves.
Mm-hmm.
But there is no shown, there's no study showing that it will actually transmit to the baby. So if a baby is positive, usually they get exposed to it after they're born through droplets from the mother or from somebody else.
Dr. Name, we announced we are going to have an interview with you. We're going to have you in our TV station a day before, just a day before. But we have lots of messages and the good things in our chat room. Still, people, you can send a message. I'm talking with the all audience. If you have any question, you can send your messages here. So, but let's back and talk about yourself. Tell us about yourself, Dr. Naim.
Yeah, so I'm an OBGYN. My practice is mainly half obstetrics and half gynecology. I trained in Mount Sinai School of Medicine in New York for my medical school and residency at the Maimonides Hospital in Brooklyn, which is one of the busiest OBGYN hospitals in the New York area. I've been practicing for the last 20 years in Los Angeles. We have an office on La Cienega and 30th Street, and we have an office next to Hollywood Presbyterian Hospital on Vermont and Sunset, next to Children's Hospital.
Mm-hmm.
I see many patients for different problems, being for birth control, being for GYN problem, pelvic pain, irregular bleeding, pregnancy, high-risk pregnancy, even if they need pregnancy termination for whatever reason, we try to help them whatever we can. I'm available usually by the phone, in person. They come to the office, they can call me. If they're my patients that I've seen regularly, I even give them my cell number so they can reach me right away or text me
Wow,
if they need to have any
so
questions.
good.
Because especially these days, if you're pregnant
Mm-hmm.
with the corona, a lot of people are very anxious and
Mm-hmm.
they're worried that what might happen or if they get exposed to it, what's going to happen. So we try to calm them down. I've had patients who had COVID positive and they were positive. They had the 2 weeks quarantine, and thank God, no complications so far as far as
Good.
my patients.
Very good. Dr. Naim, I had a question here, and one of our audience, they asked about HPV and HPV vaccine. Please tell us about that.
Yeah, HPV, as you know, is recommended now kids from 11 to 12 years old to get vaccinated.
What
The
about the
interesting
older
thing is
one?
that yeah, that's what recommended to start for the kids, and up to 26 years old is recommended. The reason that they don't recommend after 26 because they think that if by then you haven't got the vaccine, you're probably exposed to it already, and there is no point of getting it. That's the main reason. It only protects against 6 subtype of HPV. That means that if you get the vaccine, you can still get the HPV, the other types. It doesn't protect you against the other ones. These 6 subtype have the highest risk of causing cancer, and that's why they're using this.
That's
With the
that's
HPV,
I'm sorry, cancer for ladies, right?
yes, cancer for ladies. So HPV can cause abnormal cell and cancer cell on the cervix for the woman. It can cause for in men and women genital warts. It can possibly cause it. In men, it can cause scrotal cancer. Very rare, but it's possible. And also, it has been shown that if you have a throat cancer, it could be related to HPV. So these are the possible complications, but mainly cervical cancer, which we test routinely the woman for the pap smear to prevent from having any complication like that. A lot of parents are wary of vaccinating their kids. I can tell you that there's no complications that I have seen in literature, even though a lot of people don't want to vaccinate for whatever reason they have. So I do recommend it, but again, every patient differently. I've had patients who had vaccination and did have a virus because I told you the different viruses can have different subtypes. So even though you have the vaccine, you can still have the virus, you can have exposure to it. On the other hand, if you have the virus and you have not been vaccinated, I would tell you not to worry about it. It's a very common virus. They did a study in a college, and 80% of girls had the virus. A lot of them it does get resolved by
80%.
itself. Yeah, so it's very common. I tell my patients don't worry about it. The question that usually comes up is, do I tell my partner if I have the virus or not?
Yes.
And that becomes pretty much a personal decision because a lot of men already are exposed to it and probably already have it. And if you don't know a lot about it, you might be concerned. Maybe the relationship gets ruined because of this. So that's a little becomes tricky what to do. But if you have
always,
a virus,
I'm sorry,
don't
I'm
go crazy
interrupt
over
you.
it. Yeah.
Yeah, I'm sorry, I interrupt you. But as a responsible person, always I said you should share with your partner. And I have
That's true. So if you have a new partner, you should tell them that you have the HPV positive. That's what recommendation is. But know that a lot of men might be already exposed to it.
So I have a question here. She said, I'm thinking to break my, relationship with my fiance. Wow. So because I just figured out, and he told me he has a virus, and but he don't have anything on the body. It's just a virus. Should I break up, or what should I do?
So it's exactly what I just talked about it. It becomes
Yes.
a little tricky because she might already have it.
If she don't have it,
if she don't have it, but she can get it from the partner. If they have
right.
not had any relationship without any protection, then she probably are exposed to it.
But is it dangerous? But you said, but in the other side, you mentioned it's going to be maybe getting the cancer, right? For lady, is a
correct.
Serious
so
things.
If you don't have it, if you don't have it and get exposed to it, it is a potential of having cancer cell in the future. If you don't have your regular checkup and if it's abnormal cells, you don't get follow up. So there's a possibility. So again, this is not something I can say yes for sure break up or don't break up.
You are not psychologist.
So it depends how they've been together. How they've been together. Has she already been exposed to it? Does she already have it? Maybe she already had it from the previous partner.
Yes.
We don't know.
Yeah,
so
exactly.
The answer would be in general, don't just break up just because
of this virus.
Yeah,
okay.
Because you might already have it also. What would be the best option? Maybe you get vaccinated if you haven't exposed to it already, and that will protect you from any future high risk exposure and stay in a relationship if that's.
Another question we receive here in our app. How a lady get pregnant during period time? Wow. Okay.
Okay, so let me correct this, that you cannot get pregnant when you have a period. So a
Right.
period is what happens when you ovulate,
Yeah,
and if you don't get
exactly.
pregnant within 2 weeks, you have a shedding of the endometrial lining. So there is no eggs there.
Right.
But there are people who bleed during their cycles. So
Uh-huh.
they don't have the regular periods. They might be bleeding here and there. So they might be ovulating and have bleeding, which they think is a period. So in that sense, it's possible. I should tell you, I have patients who are pregnant when have period, which is not a period really, just bleeding. They have every month bleeding for whatever reason. And they come to me after 3 months, 4 months. I've had patients for 9 months come and say, Dr. Naim, my belly is getting bigger. What's going on? I have my period. And with the ultrasound, is a 9 months, baby in
Really?
there. And they didn't realize it. So you have to watch for it. So
Right.
that's how.
Right.
But if you have a regular period and your period, you will not get pregnant. And a lot of people use cycle, as a birth control. That means that they don't have sex usually those 3-4 days when you're ovulating, and a week before and a week after your cycle, it's safe to have a relationship and not worry about getting pregnant.
Okay. So, Dr. Naim, let's talk about breast test.
Yes. So breast exam is important part of the exam of a woman, because breast cancer is something that is prevalent. You don't want you want to diagnose it beforehand. In general, at 40 years old, we recommend mammogram, annual mammogram. If somebody has a higher risk of cancer because of her history or a family history, we do it sooner. We recommend patients to do their own self-breast exam maybe once a month, by just palpating the breast and look for any lumps that when you're feeling it. But just know that any lump doesn't mean it's cancer. A lot of my patients have fibrocystic breast. They have small cysts or breast in the breast, or small fibroids, that they're not cancers or precancerous. If somebody has a family history of breast cancer, we do a test called BRCA1, which is a genetic test. If you have that positive for that gene, you are much more prone of having the either ovarian or breast cancer. Some people with this with this gene are recommended to have breast mastectomy and remove of ovaries. This is something that Angelina Jolie did, for example. She took her breast out before getting to the chance of having cancers. But again, these are for high-risk people. And somebody who's not high risk, a mammogram after 40 and checking by the doctor or by the patient regularly, that should be enough to be able to diagnose any, God forbid, cancer cells of inside the breast.
So, I have a question here from Miami. My period are heavy. How can I fix it?
So heavy period has many causes. A lot of them is hormonal, could be because of weight gain, weight loss. Sometimes it could be a pathology inside the uterus. I don't know if I can show this to our viewers. We have a uterus here, right here, uterus. You can have fibroid inside the uterus that can cause heavy bleeding. You can have polyps that can cause heavy bleedings. You can have bad cells like cancerous cells that can cause heavy bleedings. So if somebody is at a young age, usually it's not a cancer that causes it. We try to manage them with either hormone therapy like birth control, being either injection, pills, ring, or IUD. If we think it's a fibroid or a polyp, we do something called hysteroscopy. I put a camera inside the uterus and we look for this abnormality and we try to remove them through the camera. If somebody is usually over 40, we do the biopsy to make sure there's no bad cells, and we treat as it goes. The other way of treatment for somebody who doesn't want to have any more kids is ablation, which I actually go inside the uterus and I burn a line with uterus by something called NovaSure. It's called ablation. That would almost 90% decrease the heavy bleeding. That would be for being a polyp or any other problem that could cause these heavy bleedings. And the last option is hysterectomy. Obviously, if someone has already have kids and have tried hormone treatment, have tried ablation, have tried even IUD, and nothing worked, and something that could be deliberately, patient cannot be able to go to work, then a hysterectomy would be an option. I rarely have done hysterectomy for this problem. Usually, ablation does give a good response.
Dr. Naim, we have another question, and we have lots of questions, but let's go with the next one. New York. She said, "I am pregnant 6 months, and should I stop sex, or is it safe or not?"
So in general, sex in pregnancy is okay. We don't have any problem with it. It might be a little difficult because of the, the shape of the abdomen and the uterus and the position. We do recommend no sex for high-risk patients. People who have something called placenta previa, that means the placenta is covering the cervix, history of preterm delivery, history of preterm labor, bleeding with sex. But if you're not a high-risk patient, you should be fine. There is no problem having sex until the end of pregnancy. If somebody wants to go to labor sooner, almost term, we actually recommend having sex because the semen have prostaglandin that can actually cause contractions. I can give you early labor sometimes if you want to go to labor. But in general, having a relationship is not an issue.
Okay, very good. Thank you so much, Dr. Naim. Last question. We have lots of questions here, but I'm going with the last one because our time is over.
Of course.
We have a couple questions about menopause. So, any vitamin, any hormone therapy, something?
So, menopause is when a woman's ovarian function stops, and they usually have lower estrogen plus lower other hormones. Some patients do have hot flashes. Some of them feel tired. In general, if you are menopausal, in the old time, we used to give everybody hormone therapy, and they found that no, it's actually not good for everybody, kind of side effects. So at this point, if somebody has hot flashes, I have no high risk history, I do give them hormone treatment, estrogen and progesterone, and that would help them. But again, I would say maybe like 10% of my patients have hormone therapy. Most of them have no symptoms. We do test for osteoporosis. If they have osteoporosis, we usually give them the medication treatment for that, something more like Fosamax. There's also injection that we can give them to protect them against future osteoporosis. We do recommend vitamins, just the multivitamins that would be helpful. But usually these are enough. But again, we go back if somebody has symptoms or not. The main thing is treatment for hot flashes and osteoporosis. Besides that, you don't really need extra medication or vitamins. The only thing that might be helpful would be calcium. So calcium, I do recommend for my patients.
Amazing. Thank you so much, Dr. Naim.
Thank you.
We have lots of questions here for different infections, for UTI, I don't know what is this, and HPV and other things. I hope to have you next time, and next week we can have another session and talk to you about the other questions and lots of things people are more curious to know. Thank you so much. I appreciate for your time.
Sounds good. It was my pleasure. Hopefully we'll see you next week.
Thank you. Sure. So it was amazing, right? Oh my gosh. So don't go anywhere. In next segment, we are going to talk to another expert to calm down and relax. Yes, let's do yoga.